But let's start with the federal government scrapping most vaccine mandates starting next week. That means proof of vaccination will no longer be required to board a plane in Canada or a train. You can also fly out of country without a vaccine pass, but if you're unvaccinated, testing and quarantine rules still apply when you return to the country. Plus, international travelers landing in Canada still have to be vaccinated. The vaccine mandate is also coming to an end for federally regulated workers, including critical airport staff like security and customs. Dominic LeBlanc is the Intergovernmental Affairs Minister. He joins me now in studio. Minister, good to have you back. I appreciate it.
Hi, Vashi. Glad to be in your studio.
Thanks for making the time. Was the decision made to suspend these mandates, was it made by Cabinet?
Yes. It's been an ongoing discussion. As you know, I chair the COVID committee of our Cabinet. It's been a subject of discussion for a number of weeks, but ultimately it was a decision made by the Cabinet.
And was it made this week? Was that decision made this week?
We talked about it last week. We talked about it again this week. It's been an ongoing source of conversation, both at the committee level and at the Cabinet level, for a number of weeks.
And ultimately, I know that your government today, in describing why it made the decision to lift the mandate, said that the epidemiological situation has changed since the fall. When I interviewed the Minister of Transport 2 weeks ago, I think actually to the day, he said that the advice from public health officials had been informing the decision to keep the mandates. Did that advice change in the last 2 weeks?
That advice, Vashi, has been a constant go-to point for the government. Obviously, the views of Dr. Tam and other public health experts inform the conversation. We also look, for example, at hospital usage. We look at the number, the stress on public healthcare systems in various provinces. There's a whole series of factors that come to this decision. We look at what other jurisdictions are doing around the world. But we think that it's a prudent moment to suspend the vaccine mandates. But as we said, if the situation changes this fall or this winter, we're prepared to bring back whatever measures are necessary to protect Canadians.
And I certainly will get to that in a second and what might underscore any change in position at that point. But I just want to make sure that Canadians fully understand how you came to this decision, because the science, saying it was the science and that situations changed. I mean, situations have changed from the fall, but the cases and hospitalizations changed very dramatically back in April. That's when there started to be more calls for the mandates to be lifted. I'm not really certain what exactly it was that so drastically changed in the last 3 months that your government could then say, okay, now is the time to lift them.
Well, it's obviously been a discussion among scientists and doctors in the public domain, and certainly within our government, about the effectiveness of vaccines in terms of preventing the transmission of the disease. That's obviously a critical factor. Vaccines are clearly the best way to prevent critical outcomes, serious diseases. But with this particular variant, at this particular moment, some of the scientific advice says that the vaccines alone are perhaps not the right tool that will prevent the transmission of the disease. But Vashi, it's not one factor, one piece of advice. It's a series of factors the government looked at and came to this decision after, as I said, many weeks of reflection. And we deliberately decided to be cautious. We deliberately decided to take our time. We're not going to apologize for that. We thought it was important to make sure that we've done everything we can to protect Canadians. And we've suspended them. We haven't lifted them in a way that they can't be put back in place should the disease and should the circumstances require.
In a tweet back in December, you point to transmission. Dr. Tam made it clear that 2 doses were not enough of the vaccine to prevent transmission to the degree it had with Delta back in the fall. That was back in December. This is 6 months later. Why wasn't there a re-examination, if not about removing the mandates, about adding a 3rd dose to the definition of fully vaccinated? You're not even, today I heard the Minister of Health say that would be appropriate, but not even saying for certain that is going to be the case.
And we're not going to say for certain that that's going to be the case, to use your word.
But you have the evidence.
Well, we have the evidence at this particular moment. We're going to see how the evidence evolves over the summer. The traditional pattern in the last 2 years is over the summer, the number of cases came down, the number of hospitalizations traditionally came down in the summer. But if the circumstances are such that we need to update in a more mandated way what the definition of up to date in terms of vaccination means, we won't hesitate to do so. So we've said now that 2 doses previously, as you say, perhaps with the Delta variant, constituted fully vaccinated. We're shifting the language to asking Canadians to be up to date in their vaccination, and we'll decide as the situation evolves over the next number of months if we need to mandate that. We're hoping that Canadians step up over the summer months, increase the number of booster doses. We're certainly not where we want to be, but we're quite confident that that number of boosters will go up.
Even without mandates?
We hope so.
So then, again, and I'll tell you why I'm asking, and you're aware of this, the opposition and people who, often representing people who did not choose to get vaccinated. And I'm going to be clear, vaccination is proven to help keep you out of the hospital, for certain. Reduce your the possibility of you getting seriously ill, 100%. The science shows that very clearly. But they felt like they were being punished, even as the science evolved, right? So once we knew in December, January, maybe even February, maybe even March, take a 4-month period to analyze whether transmission really, isn't doing what we thought it would do with 2 doses. You still kept the mandates there. The opposition says it was a political move because it worked for you in the election. What is your response to that? Do they have a point?
No, certainly not when they're talking about using vaccines or COVID as a political conversation. I mean, they have been completely irresponsible throughout the pandemic in terms of the advice they've given. They've offered simplistic solutions not borne out by any medical evidence. We will never apologize for having taken our time. We think, and the idea that it was somehow a punishment makes no sense at all, when from the beginning we've evolved a series of measures that we thought were important at different moments to protect Canadians. So the disease itself has changed, our measures will change, they'll come back at a certain point if required. So we haven't changed our approach at all for the last 2 years and a number of months how to manage COVID. We're proud of, frankly, Canada having one of the best vaccination rates in the world. We're worried that not enough people are boosted. That's going to be a priority over the next number of months. And we'll see what the epidemiology looks like when we get to the fall.
And is there anything that you can tell Canadians tonight that will give them some illumination as to how that decision will be made if and when a mandate comes back? And will it be for 3 doses?
But again, we've said now that the definition will be Canadians will need to be up to date in their vaccines. In some cases, we've heard doctors say that it might be 4 doses. So all of that will be something that we will decide based on medical advice. We're not there yet. We're not about to evolve that position in terms of a mandate yet. But what we've said clearly is that Canadians should expect, as has been the case since the beginning of the pandemic, that we're prepared to make the difficult decisions necessary to protect their health. And we'll see if there's a new variant in the fall. We'll see what hospitalization numbers look like, ICU numbers look like. There are hundreds of people in ICUs tonight, Vashi, with COVID, and thousands in hospital. So it hasn't gone away. Some of our political adversaries think that it's gone away because of some magic solution. That's not the case. And we need to be very cautious.
And I think that's a very good point. But I think because there's still the virus out there, doesn't inoculate you, or should it inoculate you and your government from questions about whether the measures you've imposed are appropriate? Do you think that there could be a higher offering of more transparency from your government if and when you decide to reimpose mandates?
Well, so we obviously think all of the measures we've taken have been appropriate based on the best available advice and information we had when we made those decisions.
But will you be explicit and say, Dr. Tam thinks the mandates have to come back? I mean, no minister will come on and say, black or white, Dr. Tam says this should be lifted, this shouldn't be lifted, know?
Dr. Tam has spoken eloquently and compellingly from the beginning of the pandemic for herself. She talks to journalists often, she does news conferences, she answers all of those questions, as she did last Friday. But we've said that we have made a decision as a government that at this particular moment it's prudent to suspend the vaccine mandates for domestic travel. We haven't changed our position, as you noted, at the international border, because, for example, neither have the Americans. So we have reciprocal measures at the international border with the United States.
Yeah, that's fine. My questions are about the domestic.
So that's right. So we think that it's prudent to evolve the domestic mandate at this moment to suspend those requirements. For example, to keep a mask mandate on. We think that it's a reasonable thing to ask people on trains or airplanes to wear a mask. It's not a very invasive way to stop the spread of COVID and to reduce perhaps for some immunocompromised or vulnerable person the chance of getting COVID.
Okay, I have to leave it there. I'm out of time. Minister, thank you for your time. I appreciate it.
Thanks, Vashi. Have a great evening.
You too. Dominic LeBlanc is the Minister of Intergovernmental Affairs. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.